Bismillahirrahmanirrahim. Succeeding Module 3, Question Time Question Bank, Module 3. Okay. Hallmark of sclerosing mesenteric on CT is increased density of mesenteric fat to 40 to 60 H Hounsfield. Hallmark of sclerosing mesenteritis on CT is increased density of mesenteric fat to 40 to 60 HU. 2. Question number 2 is clearly enhancing mesenteric mass with linear densities emanating from the mass is in small bowel loops, tethering and thickening. Most likely diagnosis is metastatic carotid tumor. 3. Which favored appendical carotid or appendical adenocarcinoma? Bulbous swelling involving the distal third of esophagus. This is distal third of the appendix involved in appendiceal carotid. Question number 4. Which favored pseudomaxoma peritonitis or sclerosing and capillary peritonitis? Scalping of liver edge. Question number 5. Pseudomembranous colitis, PMC, most common finding, chronic wall thickening, accordion sign. Question number 6. Which favored Crohn's versus pseudomembranous colitis? Pyropathy, mesenteric proliferation around involved colon. Now, in Crohn's disease, there is pyropathy, mesenteric proliferation in the colon. In pseudomembranous colitis, there is only colonic wall thickening, and it is called the accordion sign. 7. Which frequencies would most help in the differentiation between recurrent tumor and fibrosis in a 62-year-old with prior chemoradiotherapy for colorectal cancer? Which frequency? Axial T1 fat suppressed FSE before and after gadolinium. Now this helps in differentiating between recurrent tumor and fibrosis. To differentiate between tumor and fibrosis, what do? We do axial T1 fat suppressed FSE before and after gadolinium. This is the frequency we use. T1 fat suppressed FSE before and after gadolinium to differentiate between tumor and fibrosis. Question number 8. Motor vehicle accident. Most common CT finding in the shock bowel is increased small bowel mucosal enhancement. Question number 9. CT scan shows 6 mm mass in the left lobe of the liver with peripheral globular cloud-like enhancement. Mass has filled in with contrast, most likely diagnosed cavernous hemangioma. This is called centripetal fill-in of contrast. Centripetal fill-in of contrast is seen in hemangioma. It shows peripheral globular cloud-like enhancement. So from periphery it starts and fills in. Question number 10. Mass in the left lobe. Arterial phase mass enhances with small lower attenuation focus centrally. So in central lower attenuating focus and portal venous phase, central lower attenuating focus persist. Diagnosis focal nodal hyperplasia. Question number 11. Which causes of diffuse hepatic surface nodularity can be most difficult to distinguish from cirrhosis? Treated breast cancer metastasis to liver. It is very difficult to distinguish this from cirrhosis. It looks almost the same. Question number 12. 13-month post-Rooks and Y bariatric gastric bypass surgery. Small bowel obstruction. Most likely cause of small bowel obstruction at the site of obstruction is in the alimentary limb. Internal hernia. Now, complication of Rooks and Y bariatric gastric bypass surgery is internal hernia. And 13. Which feature is most likely to represent a colonic tumor rather than diverticulitis? Increased permeability on CT perfusion. Because in colonic tumor there will be increased blood flow, so this is it's a characteristic of tumor and not diverticulitis. Increased permeability to fluid and blood, etc. Question 14. In the left iliac fossa, 4 cm hypoechoic mass which is non-compressible between the colon and abdominal wall. It is surrounded by a hypoechoic border with no Doppler flow, most likely diagnosed like appendicitis. 15. Most typical finding of serous cystadenoma of the pancreas is multiple cysts less than 2 cm separated by a fibrous septa coalescing into a central scar. Serous cystadenoma shows multiple small centimeter cysts less than 2 cm and having a central scar. 16. Most commonly affected site in systemic sclerosis after the esophagus and rectal. Most commonly affected site in systemic sclerosis after the esophagus and rectal. 17. Ultrasound to 7 cm cystic lesion in the liver. Tuberous and cyst within cyst appearance, most likely diagnosed hereditary disease. Question number 18. Lesion in the left lobe of liver. Isolation tends to liver parenchyma on non-contrast CT. It is uniformly avidly enhancing in the arterial phase and again isolation tends to liver parenchyma in the portal venous phase. No alternating central scar, no central scar, no most likely diagnosis, focal neuron hyperplasia. Question 19. Which is most likely to deem a cholangiocarcinoma irresectable? Portal venous branch, PV branch to one lobe and hepatic artery to other lobe is invaded. So portal venous branch to one lobe and hepatic artery to other lobe is invaded, so the cholangiocarcinoma is irresectable. Question 20. Not a feature of Meniere's syndrome sign, dilated common bile duct below level of impacted stone. The dilatation should be above the stone in Meniere's syndrome, but if it is below the common bile duct, below the stone there is dilatation, then it is not a feature of Meniere's syndrome. Question 21. Which is a feature of men 2 rather than men 1? Pheochromocytoma. Okay, men 2 has pheochromocytoma. 3. Question 22. Most likely source of metastatic deposit to the pancreas is renal cell carcinoma. Non-renal cell carcinoma is the most common source of metastasis to the pancreas. Question 23. Which favors the diagnosis of glucagonoma rather than somatostatinoma? Predilection for body of tail pancreas. Glucagonoma is seen in body and tail pancreas. And selenoma is seen in head of pancreas. 24. Severe variety diarrhea. Hypokalemic patient. Neuroendocrine tumor in the pancreatic body. Mildly hypervascular. Most likely diagnosis lipoma. Because lipoma is just 75% occurs in the body and tail of pancreas. And then it causes diarrhea. And it is hypervascular. 25. Radiofrequency ablation treatment of hypercellular carcinoma. Risk of tumor seeding along needle tract is most true. After RFA, tumor can seed along the needle tract. So 0.5% risk of tumor seeding down the needle tract after radiofrequency ablation. Question number 26. Which is most correct regarding internal hernia after bariatric laparoscopic groups and wide gastric bypass? Incidence of small bowel obstruction secondary to internal lesion is 0.2 to 5%. Question number 27. Regarding laparoscopic adjustable gastric banding, it is connected by tubing to a port anterior to the rectal sheath. In laparoscopic adjustable gastric banding, it is connected by a tubing port to anterior to rectal sheath. So 28. Duodenal diverticum, single best answer. It is reported in up to 5% upper gastrointestinal fluoroscopy studies. Duodenal diverticum is reported up to 5% upper GI fluoroscopy studies. 29. Intraderminate liver lesion. Hepatocyte is C positive. Successfully treated for colorectal cancer last year. Lesion change of contrast in the arterial phase and wash out to the portal venous and dead phase without negative metastasis because previous colorectal cancer, and then takes up contrast in arterial phase and wash out in dead phase, so most likely metastasis. 30. CT criteria for T3 rather than T2 esophageal cancer is depth of 11 mm. Greater than 10 mm is T3. So if 11 mm depth is of the esophageal cancer, then it is T3. Greater than 10 mm, T3. Question 31. Most common MR feature of autoimmune hepatitis is enlarged periportal space is recognized finding. In autoimmune hepatitis, enlarged periportal space is recognized finding. 32. Which most favors diagnosis of an infected rather than a sterile post-necrotic fluid collection following acute pancreatitis, presence of gas bubbles. When there is gas bubbles in the fluid collection around the pancreas, so it will show infected pancreatitis. 33. Which is most common source of false positives in catheter hierarchy prepared CT colonography by computer-aided detection (CAD)? Now, hostile folds. Now, when patient has colonography by computer-aided detection, so false positive can be seen by the hostile folds because computers can make mistakes, so it may detect hostile fold as diverticulum. 34. Regarding Wilson disease, the hyperdense nodule on non-enhanced CT is the most common finding in Wilson disease. Hyperdense nodule on non-enhanced CT is the most common finding in Wilson disease. In the liver. Okay. Wilson disease shows nodules in the liver, so hyperdense nodule on non-enhanced CT is the most common finding in Wilson disease. 35. Regarding intraductal papillary mucinous tumors, it can range from hypoplasia to invasive carcinoma. Intraductal papillary mucinous tumors can range from hypoplasia to invasive carcinoma. Logic, which is the cause of smooth, irregular, and thickened folds in non-dilated small bowel intraluminal hematoma. Now, smooth, regular, and thickened folds in non-dilated small bowel. It can be caused by intraluminal hematoma. Hematoma inside the lumen of the bowels can cause smooth, regular, and thickened folds. 37. Other options don't make any sense. 37. Which represent a case of esophageal pouch in the lower one-third of the esophagus, mucosal tear or malleolus tear. Now, in lower one-third of the esophagus, the esophageal pouch can be caused by mucosal tear or malleolus tear in lower one-third of the esophagus. 38. Which is a case of decreased / absent duodenal fold scleroderma. Decreased / absent duodenal fold lesion scleroderma. 39. Pelvic MRI. Previously received radiotherapy. High signal on lumbar spine and sacrum. T2, correct? Which would always be expected to be demonstrated post radiotherapy. Bladder wall thickened. Now, a patient had radiotherapy, and then his lumbar spine and sacrum are affected by high signal, so also bladder will be also thickened. It is also with the lumbar spine and sacrum. 40. Which is the cause of generalized increased intensity pre-intravenous contrast on CT and midrandomary treatment? Midrandomary treatment causes increased density in the liver. Generalized increased density in liver and spleen. 41. Which is the cause of non-visualization of the gallbladder with TBIDA and no bowel activity, opiate use? Now, there are many causes of non-visualization of gallbladder, but in one of them is opiate use, which was in options. Non-visualization of gallbladder, I think it causes contraction of gallbladder, opiate. That's why it is not visualized after a TBIDA scan and non bowel activity. And it decreases bowel movement. It causes constipation. So, 42. Which is the best answer with regards to CT fistulography? Conventional fistulography has a higher spatial resolution. Conventional fistulography has a higher spatial resolution. 43. Diagnosis of hepatitis C. Which would have the highest accuracy in the characterization of a focal liver lesion in this patient? Microbubble contrast enhanced ultrasound CEUS. It has 96.6% accuracy in characterizing focal liver lesion. Microbubble contrast enhanced ultrasound has 96.6% accuracy in characterizing focal lesion in hepatitis C. 44. MRI in patient being investigated for chronic disease. Which is the least desirable characteristic of ultra-fast sequences based on steady-state precision? Black boundary effect. Now, when you are doing ultrasound sequences, ultra-fast sequences, then it may cause artifacts, and the most unlikely artifact is black boundary artifact. Correct? 45. Which favors gastric lymphoma rather than other gastric malignancies? Preservation of fat plane around stomach. Gastric lymphoma is benign. It does not affect the blood vessels, so it also causes preservation of the fat plane around the stomach. Question 46. Which is the most correct statement with regard to gastrointestinal stromal tumor of the stomach? General fluid attenuation or necrosis is common. In gastrointestinal stromal tumor, there may be central necrosis. 47. Which sonograph feature favors a duplication cyst rather than a macro diverticum or double layered wall? Duplication cyst shows double layered wall. Macro diverticum does not show double layered wall. 48. Which is the most common vascular complication of orthopedic liver transmutation hepatic artery thrombosis? Other option is hepatic artery stenosis, but this is not the correct answer. Correct answer is hepatic artery thrombosis. Most common vascular complication is after liver transplantation hepatic artery thrombosis. 49. In the MRI staging of rectal tumor, which is the single best answer? B. There is a prognostic difference between different types of T3 tumors depending on tumor size. Then rectal tumors, obviously there is a prognostic difference between different types of T3 tumors depending on tumor size. 50. Ultrasound with periportal hyperechogenicity and bladder wall thickening for no biliary dilatation. T2 is high signal intensity band along the portal tract and node is made of splenomegaly with siderotic nodules. Periportal band most likely causative organism is schistosomiasis. Look here, all these gallbladder wall thickening, schistosomiasis affect the biliary tract. Then there's gallbladder wall thickening, no biliary dilatation, and then so in the options are all these parasites, Echinococcus, Hydatid, but the only one of the parasite which affects the biliary tract is schistosomiasis. So this is the answer. Correct? Next.